19. And then like I worked in clinic for like private practice for like 2 years. In between, I took a break because of COVID and all this. And then I moved to the US in like December 2021 for my preceptorship at UCLA. That's where I and Margie met. If you guys don't know, Margie is also on the call. So yeah, for
Hi,
periodontics
Margie.
preceptorship.
Mhm.
Hi.
Yeah. So I did my preceptorship there for like 9 months. There, I also had an opportunity to be a part of research at UCLA. And then I continued to work as a dental assistant, like expanded function dental assistant for like 1 year in Colorado. And that's when I was applying to schools. And I cleared my IMBDA first attempt. And then first cycle, I applied only to Colorado where I interviewed, but I got rejected at. It was my dream school. And then I applied this next cycle for almost like 15 schools. I got invites from 4 schools, but I only attended one school's interview, other two I rejected because I got into NYU before that. So I had the privilege to do that. And then now, like I'm at NYU, New York University Dental School. So I just started this January, and so far it's really crazy. So just enjoy now, even though it's very hectic, like it's a lot, but enjoy right now.
Kartiga's having first world problems because it's crazy. But she's right. I mean, now even though it feels crazy in terms of time, maybe you have more now than when you're in
Yes.
school.
Yeah.
Okay,
Yeah.
sounds great.
Yeah. And if you guys want to know anything about my profile other than that, like send me a message or something in the chat. I can tell you guys if you have any question.
Yes, going forward, you guys can text the questions on chat. And if you want to speak, you can just raise your hands and we can call you guys one by one. And while we do that, Kartiga, could you maybe give everyone who's attending here a bit of a brief about your UCLA perception experience, how you applied and what that was like?
Yeah, sure. So usually preceptorship, like they have preceptorship in various departments, like various clinics, like from perio, uh, general dentistry, any all the departments like endo, aesthetic program, everything. So I applied when I was in India, and to apply, like we apply for CAAPID, you need an SOP, 3 letter of recommendation, TOEFL, ECE evaluation, everything. Other than the INBD exam, you need literally everything that you take. But I would say the selection process is not that difficult, and like it's not that competitive when compared to CAPIT. It's pretty chill to get in. So usually when you apply, I would recommend you to apply to 2 to 3 departments so that even if you're not selected for the one, you have a chance for the other one rather than waiting. And they also have deadlines. Please check the UCLA website for that. And I like the program better than like attending 1 month of preceptorship, because with UCLA you get F1 visa, as well as if you do for 9 months to 1 year of preceptorship, you also get OPT where you can work after that. So you kind of spend less money than you spend on masters, but also you get to work. So I would go for that. And you also get an opportunity to be in the dental school and like do be a part of research and also build your connections. And you would also come across a lot of students who are in the same process, like CAPIT process. So it's very easy to exchange informations and also learn more about CAPID and everything from others' experience. I really loved being at UCLA, and it's one of the best schools. So I have my part of my heart is like there in the UCLA. So it's a really good school, and preceptorship was like one good experience, because for me, I come from Tamil Nadu, and I never had anybody who had gone through the CAPID process before that. Only after coming to the United States, I got opportunity to meet so many people who are in the same process. And while at preceptorship, when I was there, it was only like observing, so you don't get to do clinical stuff. But one good thing is they also allow you to take part all the hands-on workshops that they do for the residents. So it's a good opportunity for you to learn all those hands-on courses for free, and even like conferences. If there are any department conferences, they give you free access to it. So it's really a good opportunity to build your profile on like hands-on courses, attending conferences like that. So yeah.
Okay, amazing. Anyone has any questions about the preceptorship specifically? Okay. Yes, there's Anjum. Hi, Anjum. Nice to see you here. You can unmute and
Hi,
speak.
friend. Hi. Kartiga, I'm so excited to know about your experience. I just wanted one question because I did apply for UCLA preceptorship as well. And I was just wondering, do they have opportunities to go to other departments if you apply specifically for one department only?
So it's really not that easy because I don't know from which country are you from, but for me, like I come from India, right? So for us, like in India, every department had some connection with the other clinics. Like if perio department, they work with the endo department and all this, and like kind of every faculty talks and students goes to each department. But here, like it's like a separate clinic, like it's like how private practices work. And when I was in perio, I never had an opportunity to go to the other departments, but I made a connection with a resident in oral medicine and radiology clinic. So through her, I had an opportunity to go and do like 1 week of observership program because I asked her and then I approached the program director. So it's up to you, like how you make connections, how you make use of it. But like if not, I don't think like you would have chance to go there, but you have to like make connections and approach the program director. Like we have breaks like every quarter, like every 3 months, once like 1 week, and most of the clinics work during those 1 week. So you just approach the program director and ask like in this 1 week can I come and like do observership. But you won't get any certificate for that, but you can put it in your CV like you did an observership for 5 days.
Oh,
But
okay.
otherwise, yeah.
Okay, thank you
So
so much.
it's
Yeah.
connections based.
Okay.
Thanks, Anjum. Kartiga Muskan. Hi, Muskan. Muskan is asking whether NYU really accepts candidates with B1, B2 visa, because I have heard they don't, even though their website says so. Their website doesn't say that there's any mandatory requirement in terms of permanent residency. What was your experience and also your demographic in the class, right? Do you
Okay.
have it? Yeah.
Okay. Yeah, I also saw this question in the frequently asked questions in the file. So the B1, B2 visa, it's not true because a lot of my classmates are here for the first time in the US. So they are all B1, B2 visas. They had come here before, but only on B1, B2. So they really accept the B1, B2 students. And I'm also an F1 student, so I don't think they prefer like, citizens or like green card. They accept students on other visas. And the class profile for NYU, I would say NYU is a very diverse group of students, and no other student is like similar. Like, for example, I am a UCLA preceptor, and there is nobody else. Like, I'm a fresh grad and a UCLA preceptor without any masters, like masters in public health or health administration or like back home masters. And nobody else like my profile is in the class. Same wise to anybody. So I guess there are fresh grads who just graduated in 2020 or 2020, sorry, 2022 or 2023, and still they are in the class. So I don't think they accept only, experienced candidates or fresh candidates. They have a very wide, diverse pool of students. And also another thing I saw in NYU is like they don't go very much like diverse on countries. Like they don't prefer country diversity. They prefer the application, like the profile diversity more than the country diversity. So, and
So
yearly
what does that
applicants.
mean? People of
So, like,
go on, sorry.
it doesn't mean like if there is like 100 people from, one particular country, they're not going to accept you because there are so many people already accepted from that country. Like, I mean, if there is,
Got it.
you have a very diverse profile, then you still stand a chance. Like the first preference is given to the diverse profile. in NYU rather than the
Other than
country.
your city or your country.
Yeah.
Okay,
And another question, yearly applications? No, I don't think, because I do have like fellow classmates and a senior who applied like 2, 3 days just before the deadline and still got into the school. So I don't think that matters in NYU. I mean, they do
so
recommend
yeah, NYU is
yearly
not known
applicants.
to
I mean,
be
they do
on rolling
recommend
basis. Yeah.
yearly applicants, but that doesn't mean like if you apply on last day, you don't stand a choice. You still stand a choice.
And along those lines, okay, why Dr. Vaishnavi is asked, does NYU only accept candidates with GPA above 3.5?
Sorry, guys, I don't know about the GPA. We never got to discuss about that with the classmates, because once you get into the school, those are personal questions you don't want to ask people. So that I can't answer because I'm not sure about. I don't know really to answer. Maybe I can ask for and tell Flynn so she can let you guys know, but I can't answer that.
I don't think I don't know again, because there could be data I'm missing, but personally from what I've seen, I don't think, also 3.5 is a very high expectation. I don't think that's what it is. And there's even schools like UPenn that really does care about high grades. They do look at your profile holistically, because I can think of people with a lower score that got an invitation. So I think 3.5 is anyway not something you should go by. It's a high score. So that's that. And along the line, Kartika, before we go into the other questions, I have a question, which is in NYU's letter of recommendation requirements. This is a common thing that comes up. That's why I'm asking you this. People are always confused what letter to give. The reason being, for NYU, they ask one letter from the dean, I think, and then 2 faculty member letters. While other schools, mostly the combination that you go for includes one dentist, right, from the US, mostly, or if not your home country. So what did you do? Did you give all 3 faculty members, or did you give a dentist? What was your take?
Okay, so my letter of recommendation combination was like one was from my dean of dental school back home, and the second one was from a faculty, as well as he was the dentist I worked under for a year. So he was both my faculty and a dentist. So that I gave as a second LOR, and the third one was like from the US dentist I worked as a dental assistant under. And so that's how I gave. And I also know a friend who gave letter of recommendation, one from dean and 2 from like one from the clinic dentist that she worked under in India, and the third one from being the dentist in USA. So I don't think they do recommend that, but just choose the best combination of all your dream schools so that you stand a chance every way. But NYU is not like very really specific. Like if you don't give these 3 LOS, we are not going to take you. I don't think they see a holistic approach. I mean, they have a holistic approach, and I don't think that's because even I didn't submit one with the 3 with like faculties from dental school. So I don't think that
Yes, so
matters.
this is why I wanted to ask you the question, because I feel a lot of people are still skeptical because they're worried that the school, I think even UPenn or one more school asks like NYU. So this is to everyone to say that the best combination you can use, and they're not going to use it against you. I think almost everyone that I know who got to these schools ended up giving a US dentist letter, and
Yeah.
it worked in their favor only.
With my personal experience, I would recommend one letter definitely from dean, because many schools want dean's letter, so that like if your dream school is in those schools, like apply. I mean, get a letter from your dean, and the second one should probably be the faculty from India, from your DDS dental school, because schools like UPenn don't accept letters from the MDS uh, faculties. And then third letter, you can use anyone from USA. And especially like if for me, like I had letter from preceptorship program director as well, but I didn't end up using that because he didn't get to see any of my clinical skills, but I worked as an expanded function dental assistant and for a longer period. So I thought his letter would make a difference because he can talk about my hand skills and everything rather than my preceptorship program director, because there I was just observing and like taking part in lectures. So use wisely so that it stands a choice. Yeah.
Yes. Thank you, Kartika. That's important that you cover all your skills in these various letters. So like she said, use your discretion and choose the combination wisely. Sometimes there's no right or wrong. It's just about what you choose and how that affects you in the most positive manner. Dr. Aishwarya S, you have raised your hand. Would you like to unmute and speak?
Yeah. Hi, Kartika. Hi, Flynn. Congrats
Hi.
on getting through NYU. So I just have a couple of questions. So why did you choose UCLA to do your preceptorship? Any particular reason or something that attracted you to do your preceptorship there?
So main reason was like for me, I wanted to not just do the preceptorship for just, put in my profile. I also wanted to gain experience, like wide range of experience rather than just the preceptorship. So when I talked with people and did my research, I learned only through UCLA preceptorship, you get to be a part of the research because their preceptorship is for longer periods, like 9 months. I mean, you can choose, they have even three months programs, but I chose like 3 quarters, which is like 9 months. And you also get to be a part of research. And also after that, you get OPT, which is like optional practical training. After the preceptorship, you can work. And basically you cannot work as a dentist, but you can work as a dental assistant. So for me, it gave me like 1 month, 1 year and 9 months of period in US, like for my visa purpose. So that's the main reason I chose, because I guess Rutgers and all, even though they give, I don't think after that they give you OPT, and UCSF gives in J1 visa. And when I started, those were my options, and that's why I chose UCLA over Rutgers and UCSF.
Okay, yeah, thank you. And also during your preceptorship, what did you get to do? Would you get to attend lectures and clinics as well?
Yeah, clinics, everything, like all the whenever. So you are basically put in the residence clinic, not the dental students. Like here in US, like you don't have the same clinics for everyone. Like the residents have separate clinic and the dental school students have a separate floor, like clinics. So we were in the residence clinic and we get to be part of their treatment planning and everything, like from start to scratch. And then you also attend lectures. And now I guess the program has a little bit changed, like where you have to do your own seminar presentations, assignments, like literature reviews and so many things. When we were there, it was not there. And also they have these hands-on workshops regularly for the residents. So you be a part of those hands-on workshops, like fixed jaw surgeries, like periodontal surgeries. I can only talk for the perio department because I was doing it. Other departments, I'm not sure. So these were the things I got to do. And also part of research. So the residents usually do research as the part of their residency. So once like you go there, you approach the residents and ask like, are you doing any research? Can I take part in your research? And then you go attend you be a part of their research assistant, where some residents lets you do some of the lab works or like, take part in the research meetings, help them with their literature review for their research, something like that. You don't get to pay, you don't get paid or anything, just the experience of being a research assistant, and it adds value to your profile.
Okay, thank you.
Along those lines, there's a question from Dr. Hashimi. Do we get a chance to shadow research in UCLA if we have enrolled in the preceptorship? I think you answered the question, right?
Yeah, you approach
Do you
the
want to add
resident. Yeah, just approach the
Yeah.
residents, or like, they used to have these letter heads, like, they notice boards where like they post some volunteers needed or something like that. So you have to keep looking for and like keep asking people. And it's not just in the department you have your preceptorship. You can even, like, if you know somebody else, you can talk to them and ask. So yeah, basically they don't give it to you in hand. You have to go ask and fish for it.
Yeah, guys, whatever experience you have and whatever experience you get, what's more important is how you make use of it. Even if it's a conference, one person can just go attend and be in the sidelines and come back. Another person can go attend, maybe network with like 5 people or 6 and then come back. So that will make a big difference in like, how the rest of your 2 years will pan out, because you never know. You might need them, they might need you, and that'll be like a nice collaboration. And similarly in school, like Kartika said, make sure you utilize, even if you're just going for a school visit or a school tour, make your mark there so that when you apply next time, they will remember you. And that could make a minor difference, you know, here and there for them to really want to pick you or talk to you. Dr. Nidhi Shinde, hi Nidhi. She asks, I wanted to ask about how your NYU experience has been so far in relation to academics, clinics, and faculty.
Okay. So when I got acceptance into NYU is when actually I started researching about NYU, because last year was the first time they sent Kira interviews for everyone. And since it was sent for almost 1,000 people, I didn't think I would stand a chance. So when I got an acceptance and I asked students, everybody told NYU has a very big class, like almost 400 students, because NYU takes 40 students of international, like advanced standing students like us. And then they have like almost 380 or something of the international class. And right on the first day, they put you with them. Like you don't have a separate class like most other schools. Like the first day itself, they put you with them. So everybody was saying you won't have a good faculty student ratio. But for me personally, it's not that bad. Like I thought, you have to keep waiting and all this. But in the labs, like you always have, and there are 2 or 3 faculties who are always there in the international student side like that. And one thing I'm happy is they integrated with us with the international class, like the American class. So you get to, network, and they know a lot of shortcuts and things to how to get it done than you. But first month was crazy because they expect you to start working like right from the first day. They don't have orientation like how in back home we used to have like 1 week of orientation where they show you everything. Here it is not that way. So that was a little crazy. But academics wise, it's really stressful. Every Friday you have exams, and then you have labs, you have clinical postings, and patient pool is quite good. Like among my experience from other schools, I had also been to Colorado Dental School, and when I stayed there, I lived with a student. So I feel NYU has better student pool. Patient pool than other schools. So it's really good, and they try to get you a lot of patients and all this. So that is good. And they also have this society system where they split you into like a group practice, where like you are under one doctor for the next 2 years. So they take care of you. They want you to finish the cases. They want you to finish the quota. So they take care of your patient needs, and they try to bring you patients and all this. So it's good. But we haven't started as such like clinics yet. We'll start only in July, so I can't talk much about the clinics. But labs and everything is so good, and they give you all the instruments. It's not like in India, like where they don't give you, and you have to think every time before, practicing for teeth preparation or like anything. But here they give you like burrs and everything. You can take any amount of burrs or teeth you want. So that way, it's very helpful. So yeah, it's good.
Look at you smile when you say that you can take any.
Yeah, because I want to practice multiple times, and usually I think, oh my God, I have to pay for it. I don't want to do it. But here, because you have the leverage to use, you can practice multiple times, and yeah, that really makes difference.
It's nice to hear. Dr. Pinky is asking, I'm currently waiting for my INBD's course to upload in CAAPID. It's been more than a week now. Can I just go ahead and apply to schools and let them know when my INBD is posted? Or will the schools not consider it to be a completed application? I think you should wait for this course to be updated.
I don't think CAAPID allows you to submit your application. I don't think CAAPID allows you to submit the application before everything is marked. Like they have this like tick marks, and I don't think it will show your application is complete for you to submit.
That's right.
I would advise you to call them in person and ask sometimes, or like call CAAPID, because sometimes they send and CAAPID doesn't, try to put it in your application. So once you call, they will do it immediately. Try to do that as well.
That's right. And yeah, their ADEA-CAAPID's support is very prompt, is what everyone says.
Yeah, they're really good.
And I don't think you should apply before you get it, Pinky, because even if you can, let's say, even if you can apply, don't do it, because they will not consider it to be complete. because they only have like 2 to 3 prerequisites, right? Which is TOEFL and INBD and the evaluations. So if you don't meet that, then it's like an easy reason for them to sort of weed you out. I get that UAP closes in 30th, but it's always better to apply with everything than to apply without all of it. So like, just call them today itself or tomorrow, since it's like right for you all, tomorrow, and then get that clear. Dr. Anjum asks, how much does research matter in the selection process?
I really can't answer because nobody knows what exactly the admission committee is looking at. But I know people who gotten even without research, and even for me, I don't have like a wide research or anything. I was a research assistant, but it was just during the time, and I don't think that makes a big difference rather than you having your own research. And I had few articles published, but none of it was like research based. Like it was like uh clinical cases or like any review literature like that. So I don't think it really matters much, but like it depends on schools, like which school you're talking about. And for NYU, I mean it matters, but I can't say it only matters. If you have other things like very good, I guess that should be good.
Yes, it's a very holistic approach, and I know it's the worst answer ever because none of us know what holistic means because it could be anything. But in a way, it's good because even if you don't have research, it's such a difficult experience to fill in, right? Sorry. Okay, so it's such a difficult experience void to fill in if you don't have. So that way, if you're not interested in research, I think I remember even Dr. Nourah did not have any research experience at that time because she was not interested in it, if I'm not wrong. And we have seen other people also who get through without research. But if it's something you like, then go ahead and approach someone, become an assistant, add that to your profile. Otherwise, it's absolutely fine. Tessa. Hi, Tessa. So Tessa is asking about TOEFL. She's asking whether she's also happy for you. She says congratulations. And she's asking whether you could share your TOEFL journey because her doubt is 100 plus absolutely necessary?
Again, it depends on like which school you're applying to. If they requirement is above 100, then they would definitely need it. And also, I had heard, I mean, I can't say it's from the school side, but when I talked with few students, it depends on your country also. Like, for example, Indian pool, like everybody has mostly above 100 or like 105, and like they really look at it. But if the country pool is different, then it's fine. And my TOEFL score was 102 in the first time, and second time, because it ended in 2 years, I gave my TOEFL before coming to preceptorship. The second time it was 109. I would advise, like, mostly I guess reading is what people take a dig in, like they get very low scores. So practice as much as you can, do lot of reading exercises because only that helps. First time I was very lethargic and thought, oh, I know everything and then, but reading in TOEFL is really not that, and you have to do your practice. That's the one thing that helped me, reading and listening. I did a lot of practices in YouTube and a lot of websites, and also all the ETS official books, those exercises. But if the school doesn't really ask above 100, I don't think it matters. But any day, it's like if two profiles are same, and then end of it comes to TOEFL, that's when it matters. But otherwise, I don't think if you have a better profile, TOEFL score is going to change things.
You don't know anyone in NYU who has below 100, right? Does that happen?
We haven't talked about that, so I don't really can answer for that.
Tessa, if a school is asking for a TOEFL score, then applying without that, like Kartiga said, is like a high-level gamble. You still do it and try your luck, but then the chances are very minimal. Like I doubt if I haven't heard of anyone who get in like that. So once you cross 100, then you need not have a higher score. Like she said, some will have 109, some will have 105. That's fine. But as long as you meet the threshold, it's okay. You're competitive already. But otherwise, below 100 would be playing with your chances quite a bit.
Okay, thank you so much.
All right. Dr. Yashashwi asks, could you tell your GPA? If that's something you're okay with sharing, then.
Yeah, I'm okay with 3.94. But you really don't
Okay.
need this much GPA. Like, I don't think like every school sees a GPA, because the schools that look for higher GPA didn't invite me, like you meant. So I don't think only GPA matters. So don't worry about GPA because you can't change it. Try to like improve whatever you can. So yeah.
She's right. Please don't worry about GP. I mean, worry about it if it's really low, but then don't think you will not get in at all. Just do
Mhm.
something to compensate for it, and then take care of it. Dr. Sharmeen had raised their hand.
Yeah, hi.
Would you like to unmute? Yes, hi.
Yeah, can you hear me?
Yeah.
Yes.
One of the students, I think, already asked that question about the current experience at NYU, but I would just like to extend it. And you said you got invitation from other universities, but you directly went for NYU. Firstly, if you don't mind me asking, what were the other universities, and what made you choose NYU so confidently? Like you said, what are the disadvantages now that you are seeing as a student? Now you're already there compared to other programs, because I know that we don't do the research now because all of us just want to get into any school.
Any school,
But
yeah.
when we get in, I don't think we'll have the time to ask everyone, okay, which program is better.
So the other schools I got invites from were Indiana, UCSF, and Buffalo. Indiana, I was waitlisted, and UCSF and Buffalo, I didn't give the interview because one reason UCSF was like a 3-year program.
Yeah.
So, and that's the main reason I didn't want to give UCSF. And Buffalo, I felt NYU is better than Buffalo from I talked with people, and also Buffalo weather conditions is also not that great, like because it's like close to Canada
Okay.
and like yeah, that those are the main reasons for me to choose NYU. And if you ask me, there are any disadvantages in NYU? I have thought of complaints, but I don't know if these complaints are like with every school. Like for us, like I felt they could have given us more orientation and like, slowly blended us with the the American class rather than like, just throwing us in
Yeah.
and expecting us to know things from first day. Because I come from books and notes, like way of studying back home, and here, like everything is online. Like you don't have anything like how timetable or anything like that. Everything is online, like everything is updated there. So for us to cope up with it, like sometimes we don't even know what course we are taking, what they have requirements. They don't say you or like tell everything. It's just in those course schedule, and like you have to read everything by yourself. So we didn't know many of that, and later only when they say, oh, deadline is there, we are like, what deadline? And we will be like clueless of what's happening. So those are the things I have complaints as of now. But only when I start clinics, I can say more. Right now, like since we are just started, it's mostly preclinical labs and clinical rotations where we just go and observe, like we don't do the cases. So we don't have about that. So with labs, this is the main reason, like that's the complaint. And I would say,
Okay, thank you. I think among the universities you got the invite, NYU was the clear choice.
yeah.
One second question I have, which I'm sure everyone has, and I'll let Flynn continue on this, is about the Kira, your experience, the questions. I'm sure that's an entire topic, so I'll mute myself now. Thank you.
Okay. So regarding Kira, so I would say Casper and Kira are all almost same, where like Kira, the professors from the schools itself record their questions, and mostly it's like I had seen people say it's like personal questions, but I had attended Kira for Indiana and NYU, and I didn't get like any personal questions, like where straight away they ask you for, tell me about yourself or like, weakness, strengths. Those questions were asked only in my in-person interviews that I attended. In Kira interviews, it's basically like they ask you to talk about your personal experience and what you learned. Like they can ask you about, time you had a difficulty in doing this, or like how did you manage your time, something like that. But I mean, it is personal, but it's not like very your oriented. It's more like an experienced base, like those questions and ethical questions. A lot of ethical questions would be asked. And I would say, how you prepare for Casper, you have to be like, you have to answer on every aspect of the question. First, like address okay, I would be empathetic and, think about this person and talk with them this way. So first talk in an empathetic way. Second, you try to give some solution to that. Okay, I will advise them to do this, or I'll give them to do this, or I'll find them some, if somebody's, they don't have a food or like worrying, I would find them some agency where they give free foods, or like I'll find them a job so they can get food every day. Talk like giving a solution. And last thing you should say, you should be bold and say, no, I'm not going to do it because this is the company policy or the clinic's policy, or this is how it is. So really you have to be bold, because we know, like in personal experience, like you can't say I'm going to tell or like complain about my friend to a faculty, or like I would say no to a faculty. You can't do it because that is how we think. But in Kira assessment, I feel you have to do that, because end of the day, ethics and morals, ethics matter more than the morals. So yeah. And when answering ethical questions, like talk, oh, according to veracity or according to autonomy, according to, use those ADA code of ethics term, and then answer the questions, because admission committees really like those, I guess. And practice for Casper a lot. That really helps with your Kira. For me, that is what helped, I felt.
Thank you so much. That was very helpful. Thank you.
Thank you, Sharmeen. I think Kartika just did a bit of interview coaching itself, right away, which is nice. I
don't know if I was clear, because I was not prepared for that question like directly, so it was difficult for me to articulate. Yeah,
I think you did fine. She just sum up what she said is that you need to be prepared for ethical questions. And when you speak up for ethical questions, what's more important is to speak about it empathetically. Now, even if you, just to add on to that, even if you decide to give the opposite answer, even if you decide to say, no, I will not tell the professor, right? And I will stay with my friend, in case you want to say that. I think the right way to think about it is to think, how will I present that answer empathetically? Like then you should tell them that, imagine you saw your friend cheating, right? And if you want to say, no, I will not tell my professor, then it should not be like, they are my friends, so I will not rat them out. That is very superficial. But it should be more like you want to give your friend a second chance, because all of us make mistakes, and you see that, for example, school is very rigorous, and everyone slips once in a while, and it is, you feel like a friend, it's more your responsibility to go and talk to them personally than to put them under the bus. So like she rightly said, your answers, angle, and approach should always be empathy, because all of us are expected to be like that, and especially you guys being healthcare workers, that's the expectation, that's what they want to see. So, and the reasoning is very important, because two people, like Kartika can say, I will tell my professor, Phil can also say, I will tell my professor. But why are we both telling the professors? The thinking would be very different. And that's where, we differentiate ourselves. So that's what you have to really focus on. So that's all. Okay, moving ahead, let's now call Dr. Prasanna. Hi, Prasanna. You had raised your... yes.
Yeah, thank you.
Hello.
Hi, Kartika. How are you?
I'm good. How are you?
I'm good. Also, congratulations on your admission, and also you've earned the luxury of getting as many burrs and as many teeth as you want, which is a luxury. So congratulations on that.
Thank you.
So coming to my question, it's all about the advanced standing candidate days. So with the word days, that actually is getting me nervous, because I'm really not sure how many days it would be. And second thing is, what can be expected in the interview? Is it like ethical, or they want to know about the candidate more? Could you please elaborate more on that?
Are you talking about the NYU candidate thing?
Yes.
Oh, so that is so it's basically like an orientation day. It's not any interview or anything. So basically they send you the acceptances. For us, they sent in late August. And once they send it like in 15 days, for us, like they sent last week of August, and they asked us to come on September 15th. So it's basically an orientation day. It's not like interview or anything like that. They bring you and like all the accepted students, only like 40 students that were accepted are called for those days. And then they just show you the school around and give like brief intro of the school, and like if you have any doubts, all that. So it's not a interview, so don't worry about that.
So technically, they say that they have 2 interviews. So the second interview is like expected somewhere around
Uh,
June to September.
did they tell you that? Because from the website that some of the students sent screenshot to me, it didn't mention like they have an interview.
Okay, maybe I got it wrong. But
No,
thanks for clearing that. Thank you.
I'm sorry to
I mean,
interrupt.
I'm not sure.
I'm sorry to
Okay.
interrupt. I'm so sorry. Today there was an NYU session in the morning. There was an open house, and in that they did mention that we're going to have 2 interviews. It was on the. I can share the screenshot if I've taken one.
Okay.
One
Yes,
of them is
correct.
like one of them is going to be Kira, and the second one is going to be it. Like she mentioned, it was said candidate days where I think they call in and kind of like do group interviews. But I'm assuming that it's again they've changed it this year because last year you had just Kira, right?
I think it's on the website as well, but then it's new. Last year they didn't have it.
Exactly. Yeah.
I think they
Okay.
realized that they can't. All of us are very surprised. How are they just doing Kira for so many people?
And
picking
judging
up?
people.
All of
Correct.
us thought there'll be one more session, but then there wasn't. So maybe
Yeah.
they changed their minds this time. But the
Yeah.
thing is,
Thank you,
see,
Doc.
NYU, just in case Prasanna, you or Sharmeel, you guys are wondering, NYU, even historically, even before Kira came, Kira was a surprise to everyone last year. Even before that, NYU's interview structure has always been very personal. Even ethical, they would not ask very deep, like asking you, would you tell if your friend cheated and stuff is one level of ethical. There are other level of ethical questions like teen pregnancy and like actual ADA ethical principles. NYU usually stay away from those. So even if you have a second level of interview, you know that you have to really talk about yourself and your and your values. So that's where the ethical questions also will come in. So once you crack the Kira, then it's more about selling yourself, even if they do have one. The website says it, but I think we still have to wait for the specifics to know what it will be.
Yeah, sorry guys, because for us last year they mentioned about this day and then we just had orientation. We didn't have any interviews, so I'm not
Or maybe
sure.
it's probably just that they're just trying to scare you.
I
It's
don't know.
fine then.
So be prepared. Because
I
last
think
year was the first,
NYU.
yes.
Yeah, go
Sorry.
ahead. Go ahead. Go ahead.
Yeah, last year it was new and we were also thinking they will have second round, like how can they just select from Kira? But like this is new for me because she told today they told us them like personally they have group interviews, so they might have, I don't know. Can ask for ask around and like let you guys know maybe.
All right. Thank you, Doc. My second question is about ADAT. Does NYU actually prefer ADAT, or how does it see this competitive exam as?
I don't think NYU cares about ADAT. I none of my friends had given ADAT, so I don't think they really matter or like they care for ADAT.
All
I
right.
haven't given
Thank you.
ADAT.
Oh, okay. Okay. Thank you for your valuable insights, Doc. Thank you.
Awesome. I think someone else has also asked, Purva has also asked about ADAT, and yeah, MS, I think you've answered. ADAT, when you guys give, if you are giving, don't look at it as one school's requirement because none of, except in Michigan, no one really talks about ADAT, but even in Michigan, there are students without ADAT who have gotten it. If you look at it school-wise, I mean, year-wise demographics. So ADAT is pretty much something you do just to get an edge over your application over the others. It's not something you have to mandatorily do. And if you do it, then please take the time to prepare well and get that score, which is, I think, 580 plus is what's considered competitive. So make sure that you put in the time to study. If you can't do that, then don't take it because then it just is like, waste of your time. If you think you'll just give the exam for like, just do some base level preparation, then don't go ahead and do that. Otherwise, you can try. Vaishnavi
Okay,
is asked about Kira. I hope. Yeah.
right. Yeah, I was also reading. So many people had asked about like SOP and supplemental. So like I'll
Yes, go
just
ahead.
tell for them. So for SOP, I know Meenakshi is here, so I really can't talk much. I would have literally like killed her so much. So yeah, I took their services for like first CAAPID cycle when I just applied for Colorado, and again after that for the main cycle that I applied. So SOP really needs like first thing, paid services, no matter whose you take. I feel we have to do our homeworks. Like we have to do it. Like don't expect them to write a story for you because they don't know your story. They can just write it in a beautiful way. That's the only thing we pay them for, because we can't articulate and get everything in the concise manner, whatever we need to express. But I feel we have to write the flow and everything, like how we need to start, what kind of essence we need to give. And for SOP, try to bring in more personal essence, like how you want the admission committee to know you as a person, like a resilient person, or like someone who had always come out of the comfort zone, or like someone who had a very struggling things and even you got here, or like someone who's very, multitasking and has a lot of other, like bring out those things in your SOP. Give more personal touch, like in each. Don't talk about like, oh, I did this research, I did that research. Don't talk like, right, oh, when I was doing this research, I found myself like try to bring some personal things there rather than your academic things in the SOP. And write so many stories, because every day you write, you get different stories. So I can put it this way, put it that way, and only then. So I would say please start it very early. I started like in June of 2022 for my Colorado SOP, and I only submitted my CAAPID application on February 2023 for Colorado. So I took like more than 5-6 months. And again, I rewrote completely a new SOP for the next cycle. So take time. And for supplemental questions, everybody says, I know when I was doing also, they say, oh, go to the website and see. Like, I know we can see in the website, but what actually to write? In my personal experience, I would say try to give personal essence to it. Like if the school has something on a research, then say, oh, I did this when I was doing this, so this interests me. Also read their news, like every school website has their news channels where they would say, oh, this professor has been awarded with this grant for this research. So then write about, I want to work with that professor because I had did this. For example, NYU has this APA aesthetic program or something. So if you have any experience with aesthetics, write, oh, because I have a background on aesthetics, I want to do this, or I went for an aesthetic CE course, so I was interested, and being at NYU, like give some personal touch to everything rather than just writing, oh, I like the research you're going to give. Don't write like that, because everybody is going to write it from the website. Also go to the school, or like try to be friends with people in that school, so you can get more personal things from that school and talk about that. If you know a colleague or a friend who is going to that school, write about what experience they shared with you and what inspired you from that. So supplemental also needs to be very personalized rather than just writing from the websites that everything is put up. So I feel my NYU supplemental made a difference. That's why I got in. So yeah.
Yes. Thank you, Kartiga. She is completely right, guys. The website should just be a starting point for you. Like newsletter, all of that is on the website. That should be where you first see what NYU has. But what is more important is you go back and match that with what you have, and then tell them that this is what, this is why you should take us. And supplementals, a lot of people think is not important, but it's the most important thing, because they'll begin with your statement, but then after that, when those decisions are being made, your supplementals will really stand out, especially for schools like NYU, UPenn, Loma Linda, UNC, UCLA. Don't break your heads over the questions of Boston and UAB and all, because they have just given you like 5 lines, 2 lines. It's like, just tell what you have to say and that's it. It's okay. You'll mostly not have much space to say things. But these bigger answers, those schools is where you have to really put down your foot and think, take a pause, think, and then write.
Also talk about the city that school is in, like write something about that. That also matters. And don't write like the weather or something like that. Go more specific about that, because I know it's very difficult for us sitting in one part of the country and like thinking what that city has. But do your research, talk to somebody, even like engineers or somebody in that city, so they can give you some more personalized experience rather than you see in the websites or like Google.
That's nice. You're right. Light-hearted things also make, so summary of that, the takeaway is that light-hearted points also can make, or others should make, it to your answer, because that also is accepted by the schools. Don't think that I shouldn't talk about the food there. I know people write about the food of the city because that's something they like to, because like say NYU will have food. I mean, I'm sorry, NYC will have food from like all over the country. I mean, the world, right? So that kind of thing. So all that you can talk about and show them that you're not just a dentist, but you're also like your own person.
Just to add to it, Kartiga's NYU was an outstanding answer. She happily went and quoted a Tamil movie song. So
Yeah, I literally did.
Basically, plant a recall value. That's what both of them are arriving at.
Yes, that's right. Recall value. They should go back thinking about you. They should talk about you when they have their further discussions. And this applies to everything. This applies to your statement of purpose. And this applies to your interviews. I think Yashaswini is another student who's in NYU and who had taken our
She's my flatmate.
Yes, she's also Kartiga's flatmate. So Yashaswini, I think, right, MS, who came and said that someone later on mentioned that they remembered her from the
army background. Yeah.
Background. So that's what, that's where you will stand out out of these 3,000, 4,000 people who are applying. While all the 3,000 are good, what makes you start? It could be anything. All right. Okay. Dr. Kamala is asking, did you go to school to become an FDA? Expanded from in NYC.
So dental assistant, like how dentist licensing for each states in US has different requirements. Like that, for dental assistants also it's different. So I was working as an FDA in Colorado. So basically in Colorado, you don't need to have any certifications like radiology certifications or expanded. And like as long as the doctor is okay with you working, they don't have it. So you basically work on doctor's license and whatever you do is on the doctor. So I didn't have any license. I didn't do that's another reason I moved to Colorado, because I didn't want to go and get any new licenses or whatever. So yeah, I worked as an FDA and my doctor was okay because I was a dentist and he trusted me and he didn't ask me for any certifications or programs. So it depends on the state. If you are single and you have the liberty to move anywhere, then just move to states like this so you get more experience. But if I have to look back and change something about my dental assisting experience, I would say I was working as a dental assistant in a dentures and implant clinic, which was not a general clinic. But then when you go for an interview, we are going for interview for general dentistry courses. And literally in one school interview, they asked me, you're working in a dentures clinic. Do you want to be a prosthodontist or a general dentist? So sometimes like it can you won't know what to answer. You can't say, oh, I don't like dentures, I want to be a general dentist, as well as you can't justify. So things like that can also happen. And for me personally, I thought if I had went to a general dentistry clinic to work as a dental assistant, I would gain more experience when it came to general dentistry rather than just being in a specialized clinic. So choose wisely when doing that. And also don't work under the same country dentist. Like if you're an Indian, don't go work under an Indian dentist because it's easier. Try to build your network and go to a dentist of other country, because that also might matter. I personally feel it gives you wide range of connections and it allows you to get out of your comfort zone. Yeah.
Thank you, Kartika. Right now I'm working as expanded function dental assistant under US dentist. Yeah, I mean, if we do FDA, like any special consideration, like, or do they consider it like any more chances? Or
I mean, I personally don't know, but when you go for an interview, you can get to talk more about, because you literally do a lot of things on patients, right?
Yes.
And for us, like as an international dentist and coming in US, it also allows you to talk in your interview about your patient management skills, how different. Even as a dental assistant, you can talk, but when it comes to clinical, I mean, expanded functional, you can talk more about what clinically you do and how you learned and all those. So it might matter, but it's not going to change anything big, but it matters, I feel.
Okay. Thank you, Kartika. Thanks for the info.
Kamala, the blanket rule for every experience, anything in CAAPID, is that the higher you can go on that hierarchy, like on that, ladder, up the ladder, go. So in dental assisting is great, right? Volunteering is great. If you're working, then you get to do a little bit more. And if you have EFTA, then it's even better. But if you're asking whether that will assure you a seat, obviously no one knows. But then in any category, the higher you do, like in community service, the more number of hours you have, it's better. But it does not mean that if you don't have 300 hours, you will not make it. So in any case, if it's easy to become an FDA for you, like if your state mandates are not really hard to, sort of do, then go ahead and do it, because it will add some value at the end of the day holistically in your application. But if it's something you cannot do, and then don't break your head over it thinking you will not make it in the absence of it. So that should be the general ideology for everything that you consider.
Okay, thank you. Thank you, Flynn. And congrats, Kartika.
Thank you. I also wanted to add about community volunteering.
Yes,
so
please.
I would recommend, so we know like Mission of Mercy, which happens like once in a year for 3 days. Like that is good. Do that. But I would recommend look for community clinics, like not just dental clinics, like healthcare or like any old age homes or food houses, and keep doing with them regularly, like once in a week or like thrice in a month. Do something regularly, so in like 6 months you develop a thing there, and there you might get an opportunity to be a leader. That in that way you can talk about your leadership quality, or like you can be something and you can talk about like your organization skills or something from that experience, and not just volunteering. And also it allows you to build more connections and do something. So I would recommend you guys to look for some volunteering where you can go regularly to the same place for like months and together. And for me, I feel that also helped my profile. I did like continuously with specific organization when I was in Colorado as well as in UCLA. And yeah, so I would recommend you guys to do that.
Yes, that's very, I think you can come on as a coach. MS, what do you think?
I was just
All our
typing
answers
that to her. Yeah.
seem very, very holistic. I like it. Yes, that's great advice for everyone, and that's exactly what we also say, which is do not place all your bets on these, one-day programs like Red Cross and Blue Cross and Digital Mercy. While they're amazing, and do sign up for it, and having those names on your CV is good, but make sure you go to a local facility and keep building on those hours. Dr. Vaishnavi is asking, did you get an invitation from UCLA as well, considering you didn't?
No, they didn't. They didn't.
Yeah, I think this is an example for all of y'all who often ask the question, if I do something in the school, will I get it? If I know someone inside. I think again, Dr. Sona had done a drill this season, and she also said the same thing. She closely worked with NYU and UPenn, I think, and neither of the schools invited her. And she had a great rapport with them, and she was great there. But again, holistic view, the thing that we don't know what it is, that is what happens. That's what is in the works. And that's why sometimes you just don't get called. PG, by the name PG, asks, if I'm doing preceptorship and I got interview call from the school, they'll have to go for admissions in some time. I'm not sure I get the question. Is the person here? Can you unmute? And do you mean you will have to drop the preceptorship and join the school instead? Okay, we'll move on to the next question. When they unmute and ask, we can take it from there. Dr. Lakshmi Swati, hi Lakshmi, asks, did you take bench prep course from either Stevenson's or Duggins? And there are others also who are asking about how you prepared for bench test, even though NYU doesn't have bench, right? But the other schools.
Yeah, I did take Duggan's bench test course. It was like back then it was for 14 days. Now I heard my friends saying they reduced it to 7 days or something like that, 5 days course. So I took a 14-day course, and it really helped me a lot, because now when you're in school, they expect you to know everything. And not because you're an international dentist. I feel in NYU, even for the other students, like they post videos in the online, they don't teach like like they don't spoon feed you or anything like that. So they just post videos on your Brightspace, which is a learning website, and you just see that and do it. And then when you have a doubt, you go to a faculty and ask. They might tell you, but they're not going to show you from start to end. So Duggan's course really helped me. And but after, at home, I didn't do my bench prep. Like I didn't start my bench prep because whatever interviews I got, none of the schools had a bench course. So I didn't practice much after I came from there, but I did take. And if you guys have a dream school which has bench test course, then please take it. If not, like you can do the online courses that Stevenson has, or like videos, and then ask somebody to review it. Like who knows? Like if you're friends with somebody that goes to dental school, they might know well. Or like a dentist who recently graduated, they will know all those criteria. So ask them to check, because it's not how we did preparations back home. Here they look for everything, like so many things, and their measurements are also different. Like Colorado, I guess they give specific measurements, so know how to do it and all that. So yeah, if you don't want to spend that much for the bench test course, then at least get a online course or something and start practicing and get it reviewed.
Dr. Aishwarya S., you can unmute and ask the question. I think you've also written it down. It's about your MBS and BDS score, right?
Yeah, I actually wrote it down because I thought maybe that's easier for you to answer rather than me talking and wasting.
It's okay. I mean, okay. She's asking whether she has 2 GPAs, which is one BDS and one MDS. Which one do they consider? Do they take the average of both?
I'm not sure for this. Like, I don't know the answer for this, but I have friends who did it, so I can ask them and like tell it to you, so you can tell them.
I think I can also take this one. This is if you're talking about. See, the thing is, no school really asks for like, for example, NYU does not really say you need this much GPA on paper. I think one school does. I don't remember which one, but otherwise there's no mandatory requirement on the website that says have 3.5 above whatever, which is why this question is not relevant, because any considerations they may have outside of paper will just be taken independently, meaning they will just look at your score and see, for example, imagine you had a lower score in BDS and a higher score in MDS, and they will just look at it as an improvement. If you have higher score in both MDS and BDS, then they would, just deem that you're academically really strong. While if your score has gone down in MDS, then they would probably wonder why have you gone, why has the score gone down? So these are kind of considerations they will have if you have 2 GPA. They will not really amalgamate it because they don't really need that as a parameter to, judge your application. So they will consider both of them to analyze your academic strength and to consider how they should, that holistic view, right, which we don't know what it is. That is what will come into picture here. But as a quantifiable grade, they don't really need the GPA. I hope that makes it a little clear, Vaishnav, Aishwarya.
Yeah, I got it. I actually have one more question. So this is for my CV or resume. So when we have the continuing dental education programs we attended, how many do we have to write? Because I have done a lot of programs during my master's, and I've done summer workshops even after my master's. So how do you think how do I decide which one, or whether I should put everything? Or mine is going up to more than a page, so I don't know what to really pick and choose.
So what I did was both for volunteering as well as my CE programs. So whatever online CE programs I did, I just put the heading as highlights of the continuing education program. Like that was my heading, highlights. And then in that bracket, I put total CE credit hours. And then I just mentioned the important ones. So how I chose the important ones were like the ones I did with UCLA, because I felt that was more important. And back home, whatever I did, which had the hands-on workshops with it. I didn't include just or I had got certification, like I had the tobacco cessation certificate. So those programs I mentioned it. Otherwise, I didn't put much because I felt each CE program is not going to make a change in my profile rather than the hours. And more than that, I felt all this. I wrote like things about my dental assistant, what I did, preceptorship, what I did, rather than spending the page limit for the CE programs. As well as for volunteering, I did a lot in India also. So there I just mentioned various school and public schools and public camps. And then I put whatever I did and total hours from this year to this year. That's what I mentioned. I didn't put each thing. But then whatever I did in US, I mentioned it like separately. And under that, like I put like 2, 3 lines of like what I did there. So I would recommend you to do that as well. And like if you had taken like a conference and just put that conference name and these many hours, like if it's like a 3-day conference and you attended several lectures in that conference, then put the conference name and then total number of hours.
Okay. But for the USA, like if I've attended webinars in the USA, should that come under a separate heading, or can I just include that?
Yeah, you can put online webinars or like online CE programs and then put the number of hours. Don't mention each, because if it's taking you on one page, I feel it's not worth mentioning everything separately. Rather spend that page limit to, talk about your research or articles or like your clinical experience, something like that.
Okay, thank you so much.
Thank you. I think that kind of covers all our questions. And okay, Dr. Sharmeen has also raised their hand. This can be the last question we take before we wrap up. Sharmeen, you can unmute and speak.
Yeah, it was just a
And
short
thanks,
question.
Emmons,
I typed it in
for-
as.
Go ahead, boy.
Yeah, I was just asking, can
Go
you
ahead.
repeat the timeline? When did you submit? When did you hear from them? And when did you get accepted? Just, do we know?
Okay, yeah. So I guess this year it's going to be different because you guys have Kira right now itself. For us, they sent. So I submitted my application around April 20th, my NYU application, and then we got Kira invites in July, mid-July, and we have to give by the end of July, and then we got our acceptances by the end of August, last week of August, like last 3, 4 days of August. So that's how my timeline was. And by September 15th, they called for the orientation day and asked us to pay the deposit. So that's how it worked. But I guess this year it's going to be different as they had given the Kira already to you guys. So it might differ this year. They might send out acceptances earlier.
Okay, thank you. Thank you so much.
Thank you. Dr. Ramya's question is, kindly share resources to practice ethical scenario questions. Did you practice them before you left? I mean, sorry,
Yeah,
before you left for the interview.
So for ethical as well as Casper, I would say talk if you have a friend who had already did this Casper, like if somebody has got fourth quartile, just go to them and ask them to review their answers, because our mind thinks only one way and everybody else's thinks different way. So one thing is talk to other friends, try to tell your answers for each scenario. Second thing is Google your questions, because there are a lot of medical ethical questions, not just dental ethical questions, like medical, any business, like try to think of that scenario, because Casper asks everything. And Kira also, I don't think, for me personally, when I attended NYU Kira, the question they asked was not anything based on dentistry. It was like a personal work-life culture. So the ethical questions are not only going to be based on the dental school or like dental ethics. So it can be of anything, dental, medical, or like a work-life culture, whatever. So Google all these questions and try to answer those. Have a format. Okay, first time addressing, showing empathy, talking to them personally or something. Second, this, and third, this. So like talk like this, and ask your friends to review who had already gotten into school or who already has an experience or take an interview service, and ask them to keep reviewing it. I would say practice this, because it doesn't come right away, because our mind doesn't think that way whenever we approach a situation. We just answer it one line or 2 lines. But for Kira, you have to answer it in like 3 or 4 formats. So practice that. So yeah, and also be more Casper guide. I guess everybody would know that. I use that as well, and YouTube videos.
Thank you so much, Kartiga. Guys, I really hope this helped. Kartiga has been very kind to give her answers, her experience, and also, like I said, coach a little bit here and there, even for interview. It would, and really take it for what it is, because this comes from her experience. And if there's anyone, any doubting Thomases here, anyone who's skeptical, know that this is tried and tested. Like, it's worked for her. So even if it might not work for you, it could work for you. That should be the mentality, right? So good luck to everyone who's applying. Please don't think that you're late and not applying. You're only mid-April. It is not late. Earlier, the better, no doubt. Not denying that, but we have seen so many people apply last minute, like last week, and then still get in, even in some rolling basis schools. So yes, your chances might be a little lesser, like lower than otherwise, but considering that you're gambling with like really low odds already, it could be wise for you to still apply and make sure that your application quality is good, and that is what you should give primary importance to. Thank you so much, Kartiga, for coming on. It was really, really nice to have you here and to have you help all of them. And soon enough, some of you, most of you, let's hope all of you, will be on this side of the
Yeah.
of the show.
And I get to meet you in NYU soon.
Yes, inshallah. That'll be
Good
really
luck,
nice if you
guys.
get to meet there. All right. Thank you so much, everyone. Have a good night and a good day to whoever is somewhere else.
I have one.
Yes.
So somebody has asked for my email, so I would share my email. I'm not that good with checking emails, so I would share my Insta. So if they want, like, they can message me.
Okay, amazing. Guys, please take this down so that, you can reach out to Kartiga directly if you have any questions about NYU or the process.
It's my Insta ID, so you can message me there. So
Okay.
Good luck with everyone.
Thank
Good
you.
luck for your applications, and see you on the other side soon. Thanks for having me, Flynn and Meenakshi.